Welcome to Roundtable Talk, a podcast about longevity, senior services marketing, and the quality of life as one ages. Roundtable Talk is brought to you by Pavone Group and Varsity, a senior services agency focused on helping clients win the mature market. If you like the fresh perspectives we deliver in each episode, please give Roundtable Talk a 5-star review on the podcast service of your choice.
Hello and welcome to Varsity's Roundtable Talk. Today's guest is Barbara Sullivan, National Director of the Village to Village Network. Barbara is a leading voice in the Village movement, a grassroots model that empowers older adults to age in place with community, connection, and purpose. With a background in nonprofit leadership and experience running her own village, Barbara brings deep insight into how this innovative model is reshaping the future of aging. Barbara, thanks so much for joining us today.
Well, thank you so much for inviting me. I'm very excited.
Absolutely. So for people who aren't familiar with it, how do you explain the core philosophy behind the Village movement?
The Village model was created to serve that missing middle, the middle class. 25 years ago, we are 25 years into this, the Village movement. It started up in Boston. For people who aren't, know or about the model, it's an alternative to age at home, age in your community, with practical, community-driven, aging, support services. Most of the villages are volunteer first, so it incorporates, neighbor helping neighbor, and it's to keep people active, engaged, and independent.
That's great. So what inspired the founding of the Village to Village Network, and how has it evolved since then?
So the founding was, as I said, 25 years ago in Boston. A group of homeowners in the Beacon Hill section said, we want to change the paradigm of aging. We don't want to just, get old, move to, another, community. We love our home. We love our neighborhood. How do we get there? How do we do this to sustain? And affordability was also a factor. And so they started in 2000. They opened in 2002. 2007, the New York Times wrote this article about the Village movement. And it was a boom. And you saw an explosion of villages throughout the United States, especially in some of the urban settings. You had, the Boston area, Washington, D.C. exploded, California, the Midwest, Chicago. So we have a lot of villages that just embraced it and ran with it. So you saw some regionally, coalitions popping up and creating the model or replicating the model.
Interesting. Now, I'm curious, it first started in Beacon Hill in Boston, as you had mentioned. Had other similar types of groups or organizations kind of bubbled up and then they came together, or was that really the only model of its kind?
No. And, there are similarities to many of them. There's a village down in North Carolina called Farrington Cares. They actually created something similar back in the 90s. And so we just gave it a name. We gave it, the movement forward to be able to embrace it and roll with it. And villages have similar characteristics. They're community-based organizations. They are very grassroots. You see similar in the Shepherd Centers, which they just formally changed their name, and I can't remember they rebranded. But again, it was incorporating people within a community to help each other. So
That's great.
yeah.
How did you first get involved with the Village movement?
So back in 2007, with the explosion, I had a group of homeowners. I was in Northern Virginia. I had a group of homeowners that came to me and said, we really want to start a village. Well, I was an assisted living administrator, independent assisted living, small, retirement community embedded in my community, apartment style living. And, of course, my corporate owners are like, what? We want people to move here. We don't want people to stay at home. And so I actually, was wooed by the dark side. I really loved the model. And I after 2 years, I was on their board. We opened in 2009, and then I took over the village in 2010. But early on in my career, my father was a member of Congress, and he was the last chairman of the Select Committee on Aging. And I remember as a kid growing up and going to nursing homes with my father and visiting, some of his clients. He was an elder law attorney, an estate attorney. So I really got the bug. I got the passion, for older folks.
That's fascinating. That's great.
Yeah.
So I bet you learned a lot sitting kind of at your father's knee, or so to speak, or interacting with him. I was not aware of that. That's really cool.
Yeah, well, you get to, and we'll talk about it later on too. Washington D.C.'s changed a lot, but we also are looking at, and you're aging, I'm aging. We'll have more people over 65 than under 18 by 2030.
Yep,
What is going to happen, with support services, and that's what's so critical about the village model. But
absolutely.
learning at my father's knee was the politics involved, and
Sure. Yeah.
yeah.
Yeah, I'm sure you do bring a certain savviness that you wouldn't have had you not grown up in politics.
Yeah.
Granted, a
Oh yeah.
different time,
Yeah.
but so you mentioned earlier in our discussion the missing middle, and talk a little about what that is and why the village model resonates so deeply, and really what the opportunities are for people who many of us are probably in that middle area.
So people always hear the catchphrase missing middle income, blah, blah, blah. Um, when we look at services, and I see it as a former, administrator, you had to have a certain amount of money to be able to afford, that type of, care. So we have, life care communities out there where you buy in. The missing middle, they can't afford, that level. And they're also not poor enough to receive state or, county services. And so they're looking at alternatives, how to pay for care as you're aging. And it's, incorporating, a lot of our older adults, are very independent, but maybe they had to give up driving because of their eyesight. Or maybe they just need a little bit of extra support around the house. Now, I didn't mention, Dave, that, this is a non-medical. We don't do medical care. These are people who live independently. But we also, villages connect the dots. And by that, I mean, they start in a community, it's very organically grown from the community, and they're looking at the resources that are available for older adults because at the end of the day, many people don't know what's in your community. Do you know that, the trash man will come up to your house and pick up the barrel next to your house if you just sign a little paper that says, please do this? Or, a program. The village is all about programs and keeping people engaged. Social isolation. We all lived through it during COVID. Um, we got a taste of it. Well, older adults who are homebound are very isolated and they're very lonely. So, getting people up and going, and saying, "Hey, there's a lecture on this," or "There's a great free, Tai Chi class," or chair yoga at the library today. Let's all go. And getting a volunteer if you're not driving, getting somebody to take that person to attend a program. So it's really important to keep active. It also engages people in the community. We have a lot of retirees right now, and they're looking for purpose, and they're
Yep.
looking to, give back and be engaged. And whether it's volunteering once a week, once a month, but they're giving back. And at the end of the day, we all want purpose.
Absolutely, and I think that's a great point. And I just want to underscore, with the pandemic, that it really did point out the benefits and the importance of community, of really trying to avoid social isolation. And I know that that's one of the biggest benefits of communities, but I think we have seen the results when it's lacking, and it really can be tragic in some instances.
Hmm. Hmm.
So the aging service landscape includes everything from home care to senior living communities, as we've talked about, but the village model offers something different. What sets it apart from traditional senior living communities?
Well, number one, people are living in their own homes. More importantly, people are living in their community, you know, and um, people really want to be able to um, stay in their homes as long as possible. We have a housing issue, in the United States, and it's, affordable lateral moves within communities. Let's say, oh, this house is really not conducive. It has too many stairs, but I want to stay in my community because my church is here and my best friends and my children live here and this and that. And so it really was important to um, have people embrace, the ability to stay independent and on their terms. It's peace of mind. Oh, I have this reliable. Don't get me wrong, that those senior living communities, at the end of the day, some people have to move. And, a lot of villages are partnering with those, connections. The best thing I can say about villages, they do their homework. You find, a needs assessment, what's in the community, what's needed. Um, and you partner. We have a lot of villages that partner with senior living communities, a lot, and they're doing, um, you know, uh, programs. They are sponsoring them. So it's really it's a great alternative to, as I said, that middle income. So.
Sure. Talk a little about how that works, the partnerships between communities and villages, and what the I guess what the benefit is for each side.
Well, coming from the assisted living, we always had those "I'm not ready yet," and it happens. People want to live in their homes. The partnerships. I mean, we have a great example of partnerships in Northern Virginia. There's a life care community called Goodwin Living, and we partner with them. We have for like, I don't know, since 2014. And at first, there's this little pushback, oh, it's in competition, but it's not, because not everybody, as I said before, can move into that life care. But they do programs, they are hosting, they're giving back to the community just like we are. Um, I have another partnership in Ohio that's starting to work with some Medicare Advantage reimbursement. And we're going to talk about a little bit about monies and whatnot. But again, going back to COVID, we are not silos anymore. We cannot just be in this community and not serve everyone, you know. So, and that's what the senior living communities are trying to capture, and that's what we're trying to capture.
That's great. No, that's so important, and to find innovative organizations like Goodwin Living. And I may have mentioned this to you before, but Rob Liebrick was on our Roundtable Talk podcast a few months back, talking about Stronger Memory and all of the wonderful things that they're
Right,
doing there.
right.
So
Well, that's
that's
a
great.
great program to point out because we have over 50 villages that are working with Goodwin Living on the Stronger Memory. So it's
Wonderful.
it's great, and it really provides something that the villages need. That support of a certain group of folks that are home but may have some cognitive worries.
Yeah, it's a great program, and I've become, I think a lot of us here at our organization have become evangelists for, stronger memory, if I can use that term.
Yeah.
But it is wonderful. So, you've said if you've seen one village, you've seen one village. Can you share a few examples that illustrate just how different villages can be from one another?
How long do you have?
Hey, I think I've got a meeting at 2 this afternoon. So, yeah.
Well, most villages hate that expression, but I have to say, village characteristics are very similar across the board. They're grassroots, they're nonprofits. They serve, a certain, group or, individuals. I have villages that are 14 square blocks, and I have villages that are 14 square miles. We have 60% of our villages have maybe 1 to 2 full-time employees. 40% of our villages are all volunteer, which is significant, and they work it. Uh, we have a village up in New York. It's really just a social program. I shouldn't say just. It's a great social program. It's called good neighbors at Park Slope in Brooklyn. I have a village out in Colorado called A Little Help. They have 3,000 members and 1,000 volunteers. So you can see the vast, difference. And a lot really depends on the community they're serving, what you're looking for. So many, there are villages that don't do transportation because they're in the city, like Boston. The original Beacon Hill Village is great, but I think they have paid drivers because who owns a car when you live in the city? And so, but you still need to go to the doctors. We have villages that, utilize, car services like Uber and Lyft, and they help their members get to and from, appointments or social engagements and that type of thing. So they vary, vast amount of villages. They define their village. We don't.
Sure.
So we're not a
Sure.
franchise. It's, there's not one shoe fits all.
I think that's terrific, and it's so important to give that flexibility so as to really provide support. And we've heard a lot over the years about NORCs, or naturally occurring retirement communities. I would imagine that is probably hand in glove with a village movement.
Oh yeah, we have a couple of NORCs throughout the country, and they're great. And starting my married life in a high rise condominium, you didn't really know your neighbors. You got in the elevator, you went up to your floor, you went in. You might have known your neighbor on either side, but you really And so you think about older folks and who's going to Now there's social committees and whatnot, but that's great internally. But wonder if you need to go to the doctor. Wonder if you want to create a bridge game. There's a lot of things that you can do as a village program wise, but reciprocal, services, and that's great. So NORCs are obviously naturally occurring retirement communities, but they're embedded in mostly urban settings. But yes.
Sure. Now I'm curious, have you heard any anecdotes about people who move to a particular neighborhood because of the village, or do they tend to either already live there or move there and discover it afterwards? It seems like it could be the sort of thing that could be appealing for a neighborhood to draw people there.
We do get inquiries about, I'm moving to here, and do you have any villages? We get that a lot. Not a lot, but yes, I would love more and more. We do on our website. There is a village locator map. It's not very intuitive, but it's actually, it's not bad. But you can look and see where the villages are. So if you type in a zip code, it'll say you have 23, village. We also have it where an adult child. Oh, I heard about you. Do you have one in my mom's neighborhood? But also when moving to a new neighborhood, it's kind of nice. I had a friend recently move to Bethany, Delaware, and they just found out that there's a village there, and they were so excited. There's one in Lewes and there's one in Bethany, I believe. But yeah, I mean, and it's a way for people who are downsizing to be able to connect with new people in the community. If they're moving, especially if they're moving closer to adult children or whatever, it's creating your own social, circle, which is great.
That's wonderful. And to that end, aging in place is a goal for many older adults, but it often requires more than just staying in your home. It's about having the right support systems in place. We had Dr. Sarah Geber on the podcast a couple months ago, and she was talking about solo aging and what that, how that can impact older adults. But even beyond that, what types of supports do villages typically offer their members? I know you mentioned transportation services, and a handful of others, but what are some of those specific services?
So technology, we couldn't have survived COVID without teaching some of our older adults, technology. And it's not just this, Dave. It's, not the Zoom and, it's also telehealth, being able to, and continues to be a vital area. So technology support. The honeydew list, I call it the honeydew list, but, and I'm a solo ager. If I can't lift something, I can call my local village, and I can't wait for my adult children to come. I want to do this. So it's again keeping people really independent. It's, oh, winterizing a hose. I don't know, I can't get in, to turn this on. Um, as simple as being able to put up your holiday decorations that are up in the attic, and just getting a volunteer to get the box down, or in the basement, whatever. Um, uh, and then again, the social programs, the connectiveness is vitally important. And being able to get to that. A lot of our folks have elective surgeries. And you talk about solo aging. Solo aging is not just somebody who was never married. It's people who, or adult children. I mean, my adult children live far away, not far, far away, but they're not here on a daily basis. So having that village and peace of mind to be able to call and say, you know what, I'm having some oral surgery. I just don't feel comfortable driving afterwards, a drive, but maybe we can, get a volunteer to help me. So volunteer driving, doing the grocery. I mean, let's say you have elective surgery. During COVID also, we had a lot of folks that were doing errands, and younger folks, which is great because it is incorporating that intergenerational idea, but being able to support somebody who might be homebound for a little bit by going and doing their grocery shopping for them, or picking up the groceries, or walking the dog, or you name it. So there's a lot of things that can help people be independent living at home.
Sure. As you were mentioning, villages are known for being grassroots, community driven, with volunteers at the heart of the mission. You mentioned a couple examples of the roles that volunteers play in operations, but how do villages recruit and train them?
So all the villages, because they're nonprofits, they have to do background checks on volunteers. So it's an application process, but a lot is, and I'll just give examples of when I was an executive director at my local village, Mount Vernon at home. There was a farmer's market every Wednesday, and we'd have a little table out there. They would let us do it, and it was at the library, and we would get information out. Here's membership if you want, if you have an older adult. But here is how you can actually give back to your community. We're looking for volunteers. And guess what? It's on your schedule. It's not on our schedule. It's on your schedule, which really kind of appeals to a lot of folks, because at the end of the day, you don't want to volunteer for an organization. They say, well, you have to be here every Thursday from 1 to 5, and you have to commit for a year. I'm like, well, I don't know what I'm doing next Thursday. So it really incorporates. And then, as I mentioned, the intergenerational, a lot of folks work from home, and they know Mrs. Smith around the corner, so they're willing to go and do something for her once a week. And so um, Nextdoor, have you ever heard of Nextdoor? A lot of people put up, postings on Nextdoor, and we're looking for volunteers, to help you. Do you want to help your neighbor? So it's really trying to reach the marginalized, folks in the community to, underreach, to help each other, which is great.
Sure, absolutely. Now, obviously, we've been talking about the volunteer services, but we've also talked about organizations like Uber and Lyft. But who pays for those kinds of services? Because I'm sure a lot of the services provided, whether it's home improvements, light housekeeping, other sorts of things that might be coordinated through the villages. Who pays for that?
So if it's something like Uber and Lyft, it's going to be the member of the village, not the village itself. Um, they are they're instrumental in trying to incorporate, avenues of access that you may not normally know. Um, there's an organization called Go Grandparent, and it's as easy as, because not everybody. Where's my phone? I was going to hold up my phone and say, not everybody has a smartphone. You know, so being able to, the volunteers are there, but it's scheduled. Like, most people know they have to go to the doctors at least a week in advance. So transportation is a totally, scheduled type of thing, and interactive with the office because the insurance is involved, with, our, volunteer drivers. But at the end of the day, if I wanted to go to lunch with my girlfriends, and here's an alternative. You can pick up the telephone and just call Go Grandparent. They will connect you with an Uber, and you can do a round trip, and then they will bill you directly. And so a lot of people want that last minute. But then, um, other, like I mentioned, car services, people do pay, some of the villages, bigger villages may have a car service, where not a volunteer driver, but a driver that they pay, that they use. And so it really has to fit, again, the community. Villages typically have annual dues. Um, it could be, zero, nothing. It could be $50 annually. It could be there's villages out there. My village has a steeper, thing, but they, membership due. But they also it's to do the overhead of having a staff, and it's something that when you're planning a village, it takes about 2 years incorporating. It's a business plan, you know. Okay, you want one stop, and they used to call it concierge style. You want somebody to call, to call in and say, I want Mary, to drive me, whatever, um, and having, a staff to incorporate it. Like I said, some all volunteer villages do just, reciprocal. They have, they share the service requests. So um, it really depends on the village and, the sustainability financially of dues.
Sure. Interesting. Now, you mentioned doing background checks on volunteers. I'm assuming you do that for any of the service providers that they have as part of their system. But how do they also vet those service providers?
So a good example is if somebody needs more care and they're at home. Um, we don't really vet, services, but we do actually talk to, organizations. So there's companies out there that, do this for a living, to help support folks. We used to just contact 3 or 4 home health agencies. We'd ask for a letter from them on their letterhead that they're licensed, bonded. But they also do background checks on all their employees so that we have that, in writing. Um, all of our villages do background checks on their own volunteers, whether it's somebody coming in to do the honeydew list or somebody who's going to be driving. And it's a twofold, background check. It's not just the criminal, but it's also the DMV,
Hmm.
So
Sure.
it's quite comprehensive to make sure, we're dealing with an age group, that's very vulnerable. So we need to
Absolutely.
ensure that they're protected.
That's great. I'm sure that makes them, as well as their, any family members or others that care about them, giving them peace of mind. So this is a question I like to ask every Roundtable Talk guest. What are you looking forward to as you age?
Me personally,
Yes. Yep. You personally. What are you
um,
looking forward to?
to travel, to be healthy, to um, you know, have quality. So that means engaging with other folks, to be active and to stay active. You know, and I'm not too old to make a new friend. So being out there and meeting people, and as I said, I mean, I still have my bucket list. I have things. I was just talking to my middle son. I'm like, we got to go to Portugal, maybe a Mediterranean cruise. I don't know. We got to do something like that.
That's
So,
great. And, it's interesting that you mentioned that. My wife and I were just talking yesterday. Portugal is something that so many people are going to.
I
I have
know.
a friend who's actually moved there and is working remotely from Portugal now. But I've not been there, but it's quickly rising on my bucket list as well from all the
I, you know,
conversation.
I always had the bug. My husband and I traveled extensively. We have been, so many places, and we had the luxury of that. So, it was great, and I'll continue to do that.
That's great. That's wonderful. And you'd also mentioned staying healthy, and when you're healthy, that gives you so many options, so many more options of what you can do. So, as we've talked about earlier, villages have shown that they don't have to go it alone. Partnerships and collaborations amplify their reach and impact. We've talked about collaborations with Goodwin Living and the organization in Ohio, but also as I understand it, there are collaborations with faith-based groups, healthcare programs, other kinds of organizations. Talk a little about some of the collaborations, whether it's with senior living, faith-based healthcare or some other type of group?
Well, it's funny, and we have a lot of great partnerships that have developed over the years. Faith-based, you talk about the faith-based. We have villages that are starting out of faith-based. We have a great one in Anacostia area of DC. It's called Kingdom Cares, because they realized that they were not able to take care of their aging parishioners and the support. You see a lot of these big churches. They had parish nurses, but their congregations are aging and by fast numbers, and so being able to incorporate other church members with, that we have a group of synagogues that are starting, to take care of their own congregations. And again, it's that aging, population. On the front of our website, there's a leveraging resources handbook. It's down on the right-hand corner of our website. And it's 10 case studies of villages. And we did this, it's been like 4 years now, 4 years ago. 10 case studies of villages working with their area agencies on aging and the collaborations and the partnerships. And we're encouraging this. Up in Massachusetts, our villages are working with the MCOA, the Massachusetts Council on Aging, and the dementia friendly programs. So just, looking at, we and you said healthy aging is great. How are we doing that? How are we, partnering? I love that we are just finishing, and the report's not out yet, but we did a research study on healthy aging in villages with Rutgers and Rand. And you can find it at the website villages with an S research.org. And again, it's how the perspective of people in a village and what it means and how we age healthy. And it is truly through, creative partnerships. We have my village here in New Jersey. I'm at the Jersey Shore. It's called Village by the Shore. Very catchy. But its parent organization is Jewish Family Services. And what I love about it is, JFS they serve all of Cape and Atlantic counties, everyone. But the nice thing about the village is when somebody needs a continuum of care at the Village by the Shore, they need a little bit more. They have a parent organization that's right there. They can do social services. They can do next steps. They can provide, they have, physical therapy on site. There's a lot of things to help navigate that aging. So again, it goes back to what's in your community, looking and going. And I said this to somebody recently, one of our villagers said, go and knock on their door, go to the senior center and talk to them, bring them a program, bring them somebody that, can talk, an elder law attorney. The best lecture I ever set up was through a physical therapist at a senior center, how to get up from a fall. It's like beautiful.
Yep.
The other one I did was on one of the Walgreens pharmacists, was on polypharmacy, which, was eye-opening. You can't take this medicine with this vitamin pill, and it was like, but the village went to the local senior center and said, hey, we'll bring you the speaker. Can you provide the space? So it's these conversations within the community that really garner the partnerships.
That's great. And I mean, just the two topics you mentioned, how practical. I mean, that's great to be able to offer those kinds of insights.
Oh yeah, I mean,
to the
and
folks.
it really is any age. I mean, the polypharmacy, like I had a wake up call. I was like, oh, you're supposed to take cholesterol medicine at night. I didn't realize that. I'm like, oh, okay. Oh, good
Yep,
to know.
absolutely. Those things that are probably in the fine print when you get your prescription,
Right,
right?
right. Yeah.
Um, so, talked a little about the um, the middle income folks and the variety of populations. But since many older adults do live on fixed or limited incomes, affordability is a key concern when it comes to aging in place in their homes. How do villages remain accessible to older adults with lower or fixed incomes? I know you said some villages have very low fees or no fees, but do you have a philosophy as an organization about that?
So no, I mean, you mean as far as the older
Providing
adult or the village?
how older adults who have limited resources might be able to access a village or some of the resources. Are there programs to allow them to access that?
Oh, yeah. Well, that's the nicest thing about it. I mean, there are villages out there that have pay as you can, which is if you don't have any income. Most of our villages have some type of scholarship program or an endowment. Um, and that is just for that reason. You know, you might be right at the tipping point between poverty and middle income and their very limited resources. We want to make sure that we reach all the underserved and underreached populations within a community, and money should not be an option. So, you know, when the villages are doing fundraising, and that's part of what villages do as a nonprofit, they're doing fundraising, they're writing grants, they're, getting, some reimbursement. And that case study thing, the leveraging resources case studies, the one in Colorado is getting reimbursed for some services in Colorado, but again, it's state to state, but it's also, my village in Arlington, Virginia is a county-wide village, and they have probably 40% of their village members are on a scholarship program, just for
Interesting.
that reason, so we don't want to exclude anybody. We want to make sure, we can provide this great model to anyone in the community.
That's wonderful. Now, how do the villages generally reach underserved communities or populations who might not even know that the model exists?
Again, it's partnerships within the AAAs, but also, having an open forum, direct mail pieces, the next door, what we talked about. We used to have like a welcome coffee at the library, and say anybody who is an older adult, come on over. Anybody who wants to come volunteer, come hear about our village, come hear about our programs. And it really is. It's, I'm sure, harder because it's so grassroots. Where I wish we have like 280 open villages. I wish we had 2,800 open villages. It's scaling, but it's small. I mean, it takes a lot of effort, and it is, community based. So, it's an endeavor that, we do have about 40 villages that are in like exploratory or developmental. But we're also
That's terrific.
seeing cities get involved, and that's a beautiful thing. We have like the city of Sacramento is, looking to open a village. We have one in the city of Fairfax, Virginia, that just opened. Um, and we have states that are giving money to support villages. Like the state of Virginia just gave the Virginia villages 400,000 to start new villages within Virginia. Maryland the same way. So it's catching on, and we realize, or states are realizing they can't support everybody. They need help, and CBOs or community-based organizations are the way to go.
Sure. And as you mentioned earlier in our conversation, by 2030, there will be more folks 65 and older than there are under 18. And
Yeah,
I mean, it's going to completely, change the way we age and we support
yeah.
our aging population. So that's that's wonderful. Now, ha- you're mentioning the cities and the states getting involved. Have you had much outreach to universities? I know that there's the Global Age Friendly University Network. I may have that name slightly wrong, but there are.
The OSHA, yeah,
Yep, yep, exactly, the Lifelong Learning Institute.
yeah, yeah.
Have you had any involvement with university communities, university organizations, that might be have some mission based focus?
Yes, in some respects. Like I mentioned, Rutgers, has the hub for aging. It's getting involved through the School of Social Work. Ohio State has been very involved in our Columbus villages forever. Um, but it's not so the network itself doesn't go into states. We do more of the national, and we can talk about that. Um, but we encourage and show how to go, so we're guiding them into how to work with, local governments, local universities, getting a speaker, the School of Social Work, getting an intern. Georgetown's always been involved. again, School of Social Work out in California. So these partnerships are being created, and it's just teaching our village members how to do the ask, how to, open the dialogue, and it is opening the dialogue on, what we're trying to do within communities.
Sure. No, that makes good sense. You'd mentioned about some of the villages are grant writing and securing grants. What role do regional or national grants play in keeping the movement afloat?
I think regionally, we're going to see it more. Nationally, unfortunately, we're seeing, they don't even have the Older Americans Act reauthorized at this point. That's, Meals on Wheels and whatnot. And we're facing a lot of turmoil within, they, this administration deleted and leveled the administration on community living. A lot of grants came out of there. We got grants last year, the last 2 years, to do the vaccine initiatives. And the national network got the grants, and we sub-granted to like 25 of our villages so that they could run vaccine clinics. Those monies are, I don't foresee them happening. It's more the states and then private foundations, that are working to better, communities.
Sure, and I would imagine there's a great story to tell for those private foundations and
Yeah,
other types of organizations,
yeah.
and the true impact that they can have. Now, are there examples of villages that have successfully engaged non-English speaking or culturally diverse members?
Yeah, we have a couple of hub and spokes. And again, keep in mind, these villages are organically grown from the community. So we really need interested folks. But we have successfully one of our villages up in Rhode Island. So the state of Rhode Island is a what we call a hub and spoke model. So the hub is in Providence, and they have, I think, 9 spokes in their different locations throughout Rhode Island. Um, and one is centered around a Hispanic group. We have another group in Florida, and it's through the foundation of Healthy West Orange, and they will have a Hispanic village. They're again going to be a hub and spoke. So it's a sort of like a parent sponsored, but not, it's like the main hub is your main headquarters, and then the spokes are your own village, volunteers. It can be a location within that county. We have another hub and spoke up in Portland, and again, it's outreach. That's our largest of our hub and spokes. I think they have 11 spokes at this point, but again, it's going into different neighborhoods. So it's been very successful to do outreach there, and that's how we're getting it into some of the other uh, markets and underserved
Right.
communities.
That's I admire that because that is so important to
Yeah.
involve as broad a group as you can. Now, shifting a bit, the village movement, you've referenced this a bit earlier, but has long lacked updated systemic data. You're working to change that. You've launched the Village Impact Project. Now, is that what you're doing with Rutgers and Rand?
Yes. Well, no, Rutgers, that is done, but we just signed an agreement with Rutgers to do a big census, a data census on our villages. And it's starting in another week or so, 2 weeks. And it's going to be like a 5-page survey of like all the information. And what we'll do is collect the information, and then we're going to give it back to our villages and say, when you're writing your grants, you can say the village model serves, we estimated 5 or 6 years ago about 50,000. We don't know how many we serve at this point. It's a bigger number than that. But we'll have concrete data, and it's good. It's time, and we won't get into the weeds about services and what they provide, and how many services. But it's more about the demographics and you know um, urban, suburban, rural. Where we're serving and how we're serving.
That's
So
great, and I'm sure that will be important information for grant writing, but also to help villages probably consider what their own strategic plan is.
oh yeah,
I know some are very loose, but the opportunity to determine how can we serve more, serve better, serve differently if that's the case. But that's great. Now, are there any policies or legislation on the horizon that could help accelerate village expansion? I realize
Not
there's a
really. I
lot in
mean,
flux right now, but
yeah, not, you know, so we nationally, we're twofold. So the network itself does, it's like a village commons. We do, help support, developing villages, get the outreach out. But nationally, we're a voice, and we've been asked to the table. And again, I go back to COVID and think all these silos, but we belong to Leading Council on Aging organization, and these are organizations that send letters to the administration. We're very involved in supporting getting the Older Americans Act money reauthorized. We we have been, and I just got back from the National Council on Aging, which are the ones that represent the senior centers. We have an uptick of senior centers starting villages, which is kind of interesting because at the end of the day, people go to the senior center Monday through Friday from 10 to 4, whatever. What happens if they have to go to the doctors? And they're seeing a need for their people. That so we have a great organization up in Vermont called the Thompson Senior Center. They started a village because it's so rural. They really needed to get outreach to people who are living in their in the Woodstock area. So it's great. Um, and we also went to American Society on Aging. So it's getting our voice out there, doing a poster session, we have a session coming up in Chicago at the US Aging conference, which is, they represent all the area agencies on aging. So getting our voice out there and getting our model out there is, strategically what we're doing, and getting people involved to see what community-based organizations do in the community.
wonderful. So let's say somebody raises their hand and says that they are interested in starting a village, or they've got a group of friends that live near them. How does the network, Village to Village Network, support new villages getting off the ground?
Great question. First of all, we have an opportunity membership. It's very inexpensive, but also we have a scholarship program. So if there's a community that wants to do it, we can put that. It's not that much. It's just a couple $100. But we have a toolkit, 70 pages of light reading, but it gives you instructions from A to Z. But the best thing is we do have mentor groups. We have workshops. We actually can assign a mentor to help you. It's funny, I had somebody who called the other day and she's like, I love your concept. I love, and I'm like, we're not a concept anymore. We are a model. It's not a concept.
Great point.
And I said, well, who are you working with? She goes, so it's just me. I'm gonna join. And I said, get 4 friends and call me back because it's going to take just more than you. I said, it's great, but I'm going to tell you it's an endeavor and it's something, just have a conversation. Have a conversation with the local politician. My village, we went to our county supervisor back in 2007 and said, this is what the village wants to do. And not every village has village in their name. So my village was called Mount Vernon at Home. And the county supervisor loved it. He had a town hall meeting for us, and we did a survey through that. I have a village in Ohio that went to their mayor and said, we want to start a village and we want to get a survey out. So he put it in their water bill. It's like be inventive, it's like, it's great. If you're over 65 or over 55 or whatever age you want to put on it, fill the survey out and send it back to us. Getting ARP involved. The state chapters are great. The national chapter, the national ARP is great, but the state chapters are the boots on the ground. They're really there to help in the community. So we see a lot of partnerships, but they also can provide a mailing list, to somebody in
Sure.
your community, and that's key. And also those politicians, they have their constituency list. So they can send out things in their emails and say, hey, and again, saying, we're going to have a little coffee at the local library. Come and join us. And it really works.
That's great. Now, so you mentioned things like, get more friends if it's just you, or make connections with the the local municipal government or AARP at the state level. But is there other advice you'd give someone who wants to start a village of their own?
Um, yeah, I mean, it depends. I mean, it's your community. Um, what are you looking for? Sitting down, I mean, many of the conversations we had starting Mount Vernon Home was at the coffee table at a neighbor's house and saying, why don't you look into what transportation needs are here? Why don't you look at, what it would take to become a 501c3, and dividing up the workload, jumping on some of our webinars, talking to, again, your local senior center and or your AAA, and saying, we kind of want to do this to help people who are in the community because they all can't reach everybody. And so my board president is a past public health officer. He's a retired physician. He says all the time on he lectures, he said the village model is more local than the public health department. We are just, more boots on the
Sure.
ground, which is kind of funny. Yeah.
Yeah, yeah. I mean, it is truly made up of neighbors.
Yeah.
So do you envision a future where villages are formally recognized or reimbursed through federal or state programs?
Um, I would love to have a crystal ball to, you know, um, we were well on our way. Um, we have a little hiccup. We don't know where, some of the community-based organizations, what they used to call home and community-based HCBS. We don't know where that's going to fall and whether or not, a lot pivots on the Older Americans Act monies. Who do we go to? The Administration on Community Living is gone. So where are older adults going to be falling within that jurisdiction? I mean,
Sure.
and the
So there's a
entire
lot
staff at
up in the air.
ACL was gone. There's a lot of balls in the air right now. What we can say is we're here, in the community, serving the community, navigate the finance, services, go to local, and state, and get the support federally, maybe down the line, but not in the next couple of years, I don't think.
Okay. No, that makes perfect sense and tracks with what my expectation was. Now, what are your biggest hopes for the village movement, or what is your biggest hope for the village movement in the next, let's say, 10 years?
Next 10 years, I'd like to see, well, I want to do 5 years. In 5 years, I want to add 500 villages. I'd like to add 100 villages a year. That would be great. Is it realistic? No, but if we can do baby steps in 10 years, have that, goal. But, we have about 150 villages that are over 10 years old. The model says something, and if there's a part of the community that you can branch out to and be a spoke. I just recently talked to some folks in outside of in Delaware County, Pennsylvania. One of their biggest hospital closed, just closed, and all the physicians are scattered and they're scrambling and they're like, I think we want to start a village here because we're going to need transportation to up to Philly or down to, and so it's partnering with health systems. It's looking outside that box. I foresee, a lot of changes the next year or so. We've already seen some, and they're not positive. But I think our positive is that we are here and we're here to stay. So if we can scale it, that'd be great.
Sure. Well, I know you're doing some amazing things, and the impact study that you're doing, I'm sure will add to the data that you can push out there. And as we all know, success begets success. So I think as you're continuing to grow and refine the model, as you mentioned, you're not a concept, you're a model. So
Right.
hopefully that will help to to push that. And I think to the points that you've made, we're having to rethink how we approach a lot of the community-based services. And you do provide a wonderful path to that. So,
Yeah.
Look forward to seeing how this goes. So,
Well,
one final. Oh, go ahead.
no, I was just going to say I forgot to mention the partnership we're having with Leading Age. So Leading Age is another organization. They represent all the nonprofits and
Great
long-term
organization.
care and everything. They're great, and I'm on the national board. But I got to say, they're doing a lot of outreach with community-based organizations, and they are partnering with villages, like I mentioned, the Ohio stuff. So that's where I see us. That's the vision I see as we're moving forward. That we have to create more partnerships like this. It has to be more sustainable, to grow. We need to have more outreach.
Wonderful. So, one final question. What have you learned that you wish you could have told your younger self?
I should have gotten that PhD in gerontology. But
That's great.
that I should have jumped in this earlier, even though I was in 2007. I think my younger self is that I second guessed my career choice, and never again. Yeah. Very
Hey,
fulfilling.
at least you have that wisdom now, and thankfully you found it when you did.
Yeah.
Well, Barbara Sullivan, this has been a true pleasure. Thank you for your time. Thank you for your insights,
You too.
and I always enjoy our conversations.
I do too. Thank you so much. Thanks for the opportunity, and stay cool. And we're in a heat
That's
zone
right.
here, so
That's right. It's
stay cool and
a crazy
hydrated.
time.
I know.
Absolutely. Well, thanks everybody for tuning in to Roundtable Talk, and thanks also to Dave Schaffner, our producer, and Matt Campbell, our engineer. I'm Derek Dunham, and I will look forward to talking with you on our next episode.
Thanks, Derek.
Thank you.